extraction, the eardrum is sucked in at the top due to a blocked eustachian tube. Now, we don't know at the present whether this patient's also got a blocked eustachian tube in their left ear, because the ear canal itself has got a layer of dead skin, and you can see we're starting to peel this off quite laterally. And the majority of the eardrum is also obscured by this dead skin. They were prescribed some antibiotic ear spray, and although that in some ways stopped the infection, all this dead skin on top of it was a layer of pus, and it quite often antibiotic ear spray can almost crystallize or solidify the discharge, and then it coats the canal. So patients find this extremely itchy in the ear. So I'm just using a fine end suction probe, and I've removed a bit of dead skin right near the entrance. So I'm just going straight to the eardrum now, and we're going to be really gentle. You can see I've just peeled this layer of dead skin off the drum, and the skin extends to the roof of the ear canal. It's almost like a snake skin, so when a snake's shedding its skin. The texture of this, the thickness of it, it is just a layer of dead skin that's died because of the infection. It's solidified. It's now formed a cast in the ear. It's not going to migrate on its own accord. So despite the infection being resolved, the patient's still struggling to hear because of this skin. Now that I've detached the skin off the eardrum, we can see the top part of the eardrum there, and he's also got an attic retraction here because of a blocked eustachian tube. So you're just going to see me peel away the rest of this dead skin delicately off the eardrum and then the canal. And whilst you do, I'll just answer a few questions from yesterday's video. There was a really good question yesterday relating to whether or not, if you have your ears professionally clean and the skin peels, so it kind of relates to this video, whether that also causes an itch. So if you've been watching my videos, you'll know that I've mentioned in the past that if you use a Q-tip or cotton bud and you graze the ear canal, you're actually damaging the thin layer of skin cells that sits on the ear canal. And as it says, an epithelial layer of skin. And as that skin regrows, it causes an itch. So yes, quite often when we're in the ear, as we are now, we're peeling away skin. But with a Q-tip, people are generally more abrasive, and they completely damage that layer of skin. When we're doing it professionally, or depending upon who you see, of course, you can see that we're not cutting into the skin at all, and we're just more or less peeling away. So we're being gentle. So this skin is already dead, this layer of skin, so we're just detaching it. We're not grazing the undercoat of the skin. In fact, as you probably, if you're an avid viewer of my channel, you know that I'm really careful and gentle in the ear. I really want to avoid any trauma, any bruising, any cuts. So whenever I'm peeling away skin, it's always a dead layer that's resting on the canal. But that was a really good question. The next question was whether I'm friends or do I know other UK audiologists that are on YouTube, i.e. Reese Barber, Connor. Yes, so Reese, I've trained both Reese and Connor. They both use the iClear scale. I think Reese was many years ago now, and Connor more recently. Someone wanted to know why I didn't use this, I'm not sure of the device they're referring to, a blue rubber plunger for the last video, which wraps around the wax, because it would have been uncomfortable for the patient, I think, and it's going to graze the canal wall, cause bruising, so that's probably why. Someone else commented that they said the suction wasn't very good in the last video because it took a long time to suction the oil. So I'm not sure how to respond. I've got the very best suction unit. It's a company called asmr, who are the Rolls-Royce of suction units. I'm using a standard Zollner suction probe, which is what we use for the ear. There's many different types of suction probes, a lot bigger, thicker ones, which would have too much suction, too noisy for the patient, could suck the eardrum away. Oil, of course, is a lot more viscous, it's a lot thicker. I'm actually tilting the patient's head to the side as well, so when I'm suctioning, I'm going against gravity, and we're being very gentle as we're suctioning the oil. I'm not just going to go in someone's ear and go gung-ho. No, the suction was adequate in my last video, I can confirm. Someone wanted to know whether there's a special clinical chair for audiologists. I use a surgical chair, so it's like a a hydraulic stool that can go up and down. There's also an attachment where you can rest your torso against it if you're leaning over. I don't actually use that part, I've detached that part. Yeah, I've just got a normal surgical clinical chair that I use by ENT and audiologist. Someone else asked a really good question. So as you're aware that I typically use olive oil in the ear in most procedures, but in the last one I also reverted to a bit of sodium bicarbonate drops because that wax was really cemented against the eardrum, and they wanted to know whether it made any difference. It didn't actually make any difference in that patient yesterday, but sometimes it can. Sometimes if the olive oil you feel it's not working, just revert to sodium bicarb. And if there's a higher concentration of dead skin in the wax plug, the sodium bicarb is a bit more effective. But I wouldn't say it made any marked improvement over olive oil yesterday, but I thought I'd give it a try because that wax plug was really sticky and it was stubborn, and the olive oil and the sodium bicarb, neither was doing much. So I just thought, why not give it a try just in case? But really good question, that. Someone else wanted to know is after swimming or bathing, if they cup their hand against the ear and pull away, whether that will get the water out. Not really. The best advice is to avoid water entering your ear in the first instance. By cupping your hand over your ear and bringing it out, that can be quite a powerful suction vacuum effect that you're creating, and there's always a potential of perforating your eardrum. Obviously the skin cells itself has absorbed the water, so that's going to be damp and wrinkly. That is not going to remove it. Please make sure you avoid water in your ears, guys, when you go swimming or when you go for a shower. You can get over-the-counter swim plugs, foam or silicone. You can even use a bit of cotton wool with a bit of Vaseline and just place it at the entrance of your ear. We can get custom swim wells. But yeah, that cupping suction is not going to remove water because the water, it's absorbed by the skin cells. So if you do get water accidentally in your ear, hairdryer from a distance, obviously you guys, not too close, don't want to make it too powerful and perforate your eardrum. If you can got a room temperature hairdryer, that's even better, so you can avoid the caloric effect. If the temperature's too high or too low, you can get dizzy momentarily and a bit nauseous and even sick. And short bursts, but from a distance, so it's almost tickling your ear, like a gentle wind in the ear, and that'll help dry it up. Someone also wanted to know what constitutes overusing drops, as I made reference to that in my last video. So it's not the quantity, it's how long you use it for. Most manufacturers ear drops, I think they say up to 5 to 7 days, but quite often people are using it much longer, 14 days, in 21 days, and that's quite excessive. At that stage you're going to change the consistency of the wax into almost like a fluid, a liquid, and it will get very mushy and it'll expand and swell. So always, if you're going to use drops, always follow the manufacturer's recommendations in terms of the duration. If I am going to use drops or recommend patients to use drops, I do tell them to fill up the ear for 5 minutes. So be very generous in the amount you place in the ear, but then always after a few minutes, a 5 minute soaking, so tilt your head up to the ceiling, so the ear that you're putting the drops in is facing the ceiling, so this drops has got a chance to penetrate deep in the ear. And then always tilt over the opposite way so you can drain the ear, put a tissue underneath your ear, let all these drops drain back out, because you want the wax to move away from the eardrum. If you don't drain the ear, there's always a risk of that wax running downwards towards the eardrum and sticking to the drum. So always come back the other way for the same time period for 5 minutes. So I hope that helps with that question. Well, take care, guys. That's all the questions from yesterday. I hope you're all keeping well and